Surgeons of Reddit, what was the biggest mistake you made while operating on a patient? Actual surgeons take. Got into the wrong intermuscular plane during the initial approach to an anterior base hip replacement and damaged the patient's femoral nerve. They have permanent paralysis of their quad as a result. Malpractice stories can be tough. I lighten the mood a bit. Was doing varicose vein surgery on a very posh middle-aged lady. Very cut-class accent. There was an anesthetic that we used that sometimes induced some hallucinations, either going under or coming out of anesthesia, and heard some funny things. Anyway, this lady was in recovery just coming out of the anesthetic. The team were around waiting for her to wake up and gag a little on the tube in her throat, so we knew it was time to remove it. She gagged, we removed the tube, she smacked her lips and said loudly in her incredible accent. "That's the best bit of cock I have had in years." The whole recovery room just fell out laughing. Luckily, she didn't remember it. Med student here, I was watching a knee operation when the surgeon suddenly stopped, looked towards the staff absolutely shocked, and asks, "This is the wrong knee, isn't it?" Basically he was told to operate the wrong knee, and halfway through he realized it was too good looking to be the knee that needed the operation. Luckily, there was no permanent damage done, the team re-knit everything together, and we scheduled the surgery. I'll share my not a surgeon, but encountered a weird hospital mistake. Worked for a funeral home. Picked up remains from the hospital morgue and discovered an extra foot prior to cremation. Was an interesting call to the head of that department. Veterinarian here. We do quite a few surgeries, so I hope this counts as a real response. Mistakes likely happen all the time. From nicked blood vessels to skin and organ tears. Most are probably fairly minor. In the veterinary world, I've certainly heard stories of male animals having an abdominal incision during a neuter, since someone thought it was a female for a spay. Wrong limbs can be amputated. Surgical instruments and sponges or gauze can be forgotten in patients. There are many pre- and intra-surgical checklists to help prevent these, and I am sure it is even more developed in human medicine. Fortunately for me, the biggest surgical mistake is probably a suture slipping when removing an organ, resulting in minor internal bleeding. Fairly easy to find the bleeder and get things stopped rather quickly. Or having a small bone break when repairing another fracture. Things happen. We address it and learn from it for all future patients. Not a surgeon, but work for pathology. An oncologist I met at the lab would tell me all of these horror stories. We'll never forget about the one time a nurse threw someone's donated organ transplant into the rubbish bin or when a man had the wrong leg cut off.